All right, so now we're going to do the indirect method of leg length inequality. I'm going to actually show you a little modification, so I call it the modified indirect method, or the MIM, leg length inequality. And here we do it in standing. And for me, this is my preferred method, particularly for getting what exactly is the leg length in a functional position. If you look at all the literature regarding radiographic analysis, that yes, they're very accurate whether you do it supine or you do it standing, but the issue is when you do it standing, you're accommodating everything in the whole lower kinetic chain. So you're pulling in the foot, you're pulling in joint compression, you're pulling in any sort of varus valgus, laxity in the knee, any tightness, any weakness from muscle asymmetry. So you're really pulling it all together, because ultimately issues are going to be derived from forces that are produced during functional activity. And so the supine method sort of falls short with that, whereas the standing method does not. It pulls everything in. So you're just getting a total leg length. So if you want to call it functional or a combination of functional and structural, that's exactly what it is. So what we always start with is standardizing our patient or our subject. And I use a block of wood that is 7 inches in length, and this was derived from the literature of a researcher that looked at hundreds of pelvis shots in the analysis of leg length inequality, taking a single standing pelvis x-ray. And the determination was that the average distance between the femoral heads was about 7 inches. And the thought was that if you block the feet the same 7 inches on average, that you will create a parallelogram and you reduce sway, which can influence the measurement in standing. So it's a sort of a factor to standardize and to sort of reduce movement in the standing position. So I always use a 7-inch block of wood. So what I typically have my subject do is bring the feet just a little bit apart, and I'll put a block of wood against one of the heels, and I'll ask them to bring in their heel to the other side of the block. Now, the next thing I have them do is I don't want to have them force their foot into a straight position. I want them to be in a standing relaxed position. So if they have a malleolar torsion that's a little different on one side than the other, then I don't mind it being there. So what I usually ask our patient to do is to lean a little bit back on the heels and pick the front of their feet up, and then lean back on your heels and pick it, and now just put your feet down in a very comfortable position, whatever that is for that individual. And so we're really set now to take the measurement for leg length inequality. And I don't know if we're going to see everything from this angle, but I will go through it. I am going to actually probably move on to this side. Okay? And our first viewpoint of what we want to do is look at the iliac crest heights, okay, in standing. Okay, so we're going to palpate them, but the most important aspect of the measurement is if you're palpating the crest heights, you don't do it from a perspective above, you don't do it from a perspective below. You always want to get your eye level to that point of what you're palpating. Okay, and so we're going to do that first, then we're going to find the ASIS. And we also want to get onto the inferior shelf. And sometimes in standing, things become taut. And so what we want to do is that if we're not getting a good palpation of our ASIS, that we want to ask our patient to actually flex forward at the hip. So flex forward at the hip if you can, please. Just like bow forward. Okay, a little bit more. And what that does is put the soft tissue on slack, and then I get my thumbs underneath, and then I ask them to stand up straight. And so you want to make sure that they're in a erect standing position, their knees are extended, they're in hip extension. So let's take a different look at this, because I'm going to block the measurement from the camera. Okay, so we have a little bit of a closer view, and what I'm going to do is again start with palpation of the iliac crests. And I am going to go sort of at mid-girth on either side. I'm going to palpate the iliac crest, try to go above it, and then come down on top of it. And what I want to do is I want to try to keep my fingers to the horizontal. So if I'm tilting my fingers this way when I'm doing my palpation measurement, it certainly can give me a measurement error. So the goal is to try to keep the fingers level to the horizontal, be on top of the crest, come down where you can't come down anymore, and then bring your head to the level of that measurement. So let's do it. So I'm on top of the crest, and I'm trying to keep my fingers level, and when I look at the position of my fingers, I see that my right hand, which is his left side, is higher than his right iliac crest. So, which was kind of what we measured in supine. So the next thing is I'm going to go double check my measurement. And I'm going to palpate ASIS. And I can feel it, but not great. So what I'm going to ask our patient to do is to bow forward, just bow forward a little bit, put his soft tissues on slack. See, now I can feel it, and I can get underneath the inferior shelf with my thumbs and then have him come to erect position. And I also want to try to keep my thumbs as horizontal as possible. And you can see, or hopefully you can see, is that his left ASIS is up higher than his right. So we have an asymmetry where both ASIS and crest are higher on his left side and lower on his right side, which, you know, is an important pattern to see. So the next thing that we're going to do is we're going to try to correct that leg length by using shims, and then go back up and check the measurement, and hopefully when we feel like we've had him have our patient in a relatively level position, that's going to be our difference in our leg length, or our functional leg length. So now we're going to take a closer look at how we do the Shim method. And again, we need the block of wood between the heels. We want him in a comfortable standing position, whatever his natural toe in or toe out is. And we've established that the right leg is shorter. So now we want to find out how much shorter. And the first measurement is typically an estimation of what you think the distance was between your palpation points. And I'm going to probably shoot with about 8 millimeters. So I have a shim that's exactly 6 millimeters, and actually these individual ones are a millimeter apiece. So I have a 6 and I have 2, so I'm hoping 8 will do the trick for us. Now what we want to do is, I always have the subject just put their hand on my shoulder, so they're balanced, lift up the short leg, and then I push this against the block, and then we bring the heel back to that block. Okay, and just slide the heel in just a little bit more. So you always want to try to be consistent so you're going to have reproducibility. All right, so this is our Shim method. So we're going to go back up and we're going to check. So now we're going to go up and check. We just shimmed the short leg, and we put in about 8 millimeters of shimming underneath the shorter leg. Now we're going to go back up and check the pelvis. So again, we want our patient standing erect. We have the feet blocked. I am going to palpate the superior portion of the iliac crest, and I'm going to palpate the ASIS, inferior shelf. What I'm noticing is he's better, but I didn't completely correct him. So I'm going to go down and shim again, and let me add about 2 or 3 more shims. Let's put your hand on my shoulder, and whoops, and let's get that foot a little bit forward. All right, now knees straight. Okay, so I'm going to go back up, and I have my vision is right at the heights of the iliac crest, and he is looking pretty level there. And it's very interesting, the more you get him to a level position, the better you actually can palpate the ASIS. I don't really have to ask him to flex forward. I feel him really nicely right now. Okay, and he looks pretty level. I would say I'm like a millimeter off. So let's check our shim. So let me pull these out. Let me sort of count what we have. So we shimmed our patient with 6, this is 6, 7, 8, 9, 10, 11. He has a 11 millimeter difference between his right leg and his left leg, and his left leg is the longer leg, the right leg is the shorter leg.